So my name is Daniel Refai. I'm a professor of neurosurgery and orthopedics at Emory University in Atlanta, Georgia. I'm also the vice president of medical affairs at Emory Midtown Hospital.
What are some of the key things as businesses open up they should implement for screening for COVID environment?
I think that's a great question. I think one of the key things is you have to provide an environment that's safe, not only for your employees, your patients, your customers, which is going to require you to do multiple different things. One is going to be social distancing, one is going to be hand sanitizing, adequate and frequent temperature checking. I think a policy of wearing masks, we know these are effective ways in preventing the transmission of COVID-19.
Once the vaccines becomes available, are they going to be a lifetime protection, or we would have to keep up with these precautions?
I think it's another great question. I predict, we know from our experience with coronaviruses that COVID-19 is a coronavirus, that just like the influenza virus, which is a coronavirus, that we're going to have to require most likely yearly vaccinations. And there's actually talk of even requiring 2 vaccines for COVID-19. So one could imagine 1 or 2 vaccines per year in addition to the influenza virus specifically aimed at COVID. So I think that this would be a yearly thing. And I also believe that, coming to terms that we're going to be having new social norms where hand sanitization, wearing masks, social distancing, temperature screening are probably going to be with us for a very long time moving forward.
How would you use IntelliStart Station in a hospital environment?
So I think in our current models, we are screening at the entrance sites. Usually you're being screened once you enter the building. And then throughout the day, there are many sites where we have hand sanitizers. My prediction with IntelliStart is you would have the device set up at the entrances, at the exits, at elevator sites, cafeterias, anywhere where you have contact with other individuals, including in hospital wards and even potentially in front of hospital rooms for patients. And I think what's nice about the IntelliStart is that you're not only doing the temperature screening, but you're also getting the hand sanitizer. And I think that is usually, I think one of the biggest issues is compliance. So I think this allows you at the same time to increase your compliance rates with high fidelity.
What's Why is it so important to sanitize your hands?
So we know that hand sanitization is a very effective way in preventing disease illness. This is not only with viruses such as COVID-19 or influenza, but also bacteria. As physicians, as human beings, one of the most common ways of transmitting disease is actually our hands. And so keeping your hands clean, sanitizing your hands often are an extremely effective way in preventing disease transmission.
Thank you, Dr. Refai, for taking the time during your busy schedule.
Thank you.